I believe the Austin Police Department must stop responding to mental health calls.
A message from the Austin Police Association president after now former police officer Christopher Taylor was sentenced to 2 years in prison for the 2019 death of Morris Da Silva during a mental health crisis.
We have never claimed to be mental health experts, yet we are continually scrutinized for our handling of these situations.
Since the Austin Justice Coalition's inception, the group has called for community alternatives to policing.
I think as an officer, if I'm trained to go weapon first in an instance where I think my life is in jeopardy, you know, as much as I hate that, I can empathize with Chris Taylor if I'm thinking that way. But the fact that we send people that we train to really just put out a fire at all costs, the fact that we send them first and foremost to these type of situations, I think is a huge red flag.
Currently, when someone calls 911, they're given 4 options.
Also 911, do you need police, fire, EMS, or mental health services?
If the caller says mental health services, an initial assessment is done to ensure there isn't a public safety issue, and then they're transferred to one of the 19 integral care clinicians, something that wasn't available during the 2019 Da Silva shooting.
I absolutely think this person would be alive, and I think many other people would be alive.
An integral care representative says the clinicians are able to de-escalate situations, provide resources and emotional support, and make a safety plan with the caller. If needed, they can deploy their expanded mobile crisis outreach team, which is usually a clinician and a peer support. In fiscal year 2024, the call center clinicians handled almost 5,000 calls. 87% of those calls were resolved without sending them back to police.
There are people that they give a very huge portion of their lives to learn how to handle people that are going through mental duress, handle people that are going through some type of mental breakdown, as opposed to a cop who, out of 6 months of training, if they're lucky, they'll get 40 or maybe 120 hours.
Not all mental health calls for service, though, are vetted through clinicians. Austin Police reports responding to anywhere from about 34,000 to almost 52,000 mental health calls for service each year since 2020. In that time, the Austin Police Department says there were no instances of deadly force noted for any identified mental health calls for service.
For it to be 0, I think that's a lack of being able to identify and actually record accurately.
The Austin Police Chief says they will continue to respond, saying in part, quote, "We must prevent harm to all Austin community members, including our responding officers. Moving forward, we'll be working hard to develop a holistic response to persons experiencing a mental health crisis."
I think the biggest thing is just, again, opening up the box of public safety to more than just police, giving community groups the funding they need to really ramp up and be able to provide service to not only like little pockets of communities, but to the city as a whole.
Meredith Aldis, Fox 7 Austin Crime Watch.